Receiving the call for a transplant.
You need to be ready, willing, and able to accept an offer when it comes. We will need to get in touch with you. A cell phone is the best way for us to reach you. Make sure that your voicemail is set up. Organs have a limited window of time in which they are able to be transplanted. If we can't reach you within 30 minutes, the organ will be offered to the next person on the list. You will have to decide if you want to accept the organ offer. Health Canada has strict rules, and only organs that are suitable will be offered to you for transplant. There may be times when the complete donor history is unknown. The donor may have lived a high-risk lifestyle. They may have been exposed to a virus that you have not. They may have an underlying condition. Be reassured that the transplant doctors are aware of these possible risks, and the offer will only be made to you if they feel it's safe to go forward with the transplant. If you do accept the organ, we need your phone line to stay free, as we may need to call you again. Call your support person so that they can make any phone calls for you. If you decline the organ offer because you are not comfortable with the risks associated with the organ, or if you just don't feel ready to receive a transplant at the time of our offer, your transplant team will talk to you about this and discuss your position on the wait list. If you have accepted an organ offer, the on-call coordinator, probably not your own coordinator, will talk to you about how you will get to the hospital. How far away you live and the timing of the surgery will determine how you get there. It's important to tell the on-call coordinator if there is any delay in you getting to the hospital. Once you accept the offer, don't have anything to eat or drink except for water. If you are diabetic, discuss this with the on-call coordinator. The on-call coordinator will tell you where to go to be admitted. Don't forget to bring your healthcare card, picture ID, and items such as a bathrobe, slippers, toothbrush, and a comb. Bring your medications too. The admitting department will then send you to a unit where you will wait for your transplant. This will be a busy time. You will be seen by lots of staff. You will have blood drawn, and you will need to go for other tests such as x-rays. Sometimes the wait can be long before you go to the operating room. The staff will keep you updated. Not all organs are suitable for transplant. Your donor organ will be looked at before your surgery. We will not proceed with the transplant if the doctor suspects a problem with the donor organ. If this happens, we call it a dry run. Sometimes dry runs can happen more than once. If you do have a dry run, you will be responsible for your own transportation costs to reach your home. Don't get discouraged. Our goal is to give you the best possible outcome. Let's work together towards making your transplant a success.